So today's session will cover an overview of Health Data Research Network Canada. We will then speak to the Data Access Support Hub, a service that's been established to support data access across the country. Then I will hand it over to Dr. Etier, who will speak to distributed analysis for multi-regional research. And then we'll close the session with how you can get started with the Data Access Support Hub and distributed analysis. And then finally, a question answer period. Okay, so HDRN Canada is essentially a network of organizations from across the country and data centers which are brought together to lead transformative and world-leading health data use. Our vision is to promote and drive improvements in health and health equity. So one core important pillar of HDRN Canada is to help develop and improve services and supports for data access, and that's where the Data Access Support Hub comes in. Another key and integral part to our network work is to essentially promote innovation in the field of research. And this is where Dr. Etier's work is going to come in, and he'll speak to more around new novel techniques being used to help address challenges that researchers face in doing multi-regional research. So our network is composed of member organizations from across the country. We have data centers in every single province that participates in our network, as well as pan-Canadian data centers and additional partners as well that support and work with our network. So for example, in Alberta, we have the Alberta Spore Unit that works within our network. We also, in Manitoba, have the Manitoba Centre for Health Policy. In Prince Edward Island, we have the
Secure... Need some cheese. It's absolutely green.
Sorry, just heard someone's background noise there. Apologies.
Yeah.
In Prince Edward... Oh, are we able to mute the participant? Okay. So in Prince Edward Island, we have the Secure Island Data Repository. We also have pan-Canadian data centers that work within our network, such as the Canadian Institutes for Health Information, Statistics Canada. And so altogether, these organizations collaborate through our network to facilitate and improve supports for data access, as well as multi-regional research. Next slide, please. So a little bit about the Data Access Support Hub. So the Data Access Support Hub is a central coordination point for researchers who want to conduct multi-regional research. It includes a team of representatives from the multiple data centers that I spoke to earlier that are a part of our network. And together, they work to support researchers in obtaining administrative and other data for research purposes. And we help and facilitate and coordinate with the research teams and the data centers to make the data access journey easier and more efficient. And the data are available and accessible through the data centers and are subject to region-specific legislation and policies when it comes to data access and release. I also wanted to mention that through the Data Access Support Hub, we have designed and developed, next slide. We have developed and designed multiple supports and efficiencies to simplify the data access process. So for instance, we provide navigational support to researchers who are conducting research projects throughout the life cycle of their projects. So, for example, if you're a researcher and interested in understanding what data is available through our member organizations, you can get in touch with us and we can guide you through that. We also provide feasibility assessments and cost estimates for your specific requests, up to actually providing you with analytical support if you decide to move forward with a specific project, and all the way to the end of the life cycle of the project if you're accessing that data securely in a trusted research environment. So we're really there to guide you through that process from start to finish. We also offer a suite of different centralized resources and tools at hand. So, for example, we have a data assets inventory that allows our researchers and other key stakeholders to look at what type of data is available within each of our member organizations. We also have harmonized services where we can to help make the process more efficient for researchers accessing data. And so essentially what we've created is a centralized form where researchers can provide us details around their projects and high-level data requirements, and we can look at that and sort of essentially determine if the project is feasible at our member organizations and what the estimated cost would be. We also offer technological solutions to different challenges experienced by researchers in doing multi-regional research in Canada. And so Dr. Etier will speak more to that a little bit later on. I would like to also mention that one great thing about being a part of the network is that we really offer expertise available to you. So whether or not you're a public sector researcher, a private sector researcher, a knowledge user, we have different lines of services available to kind of support your data access needs. And so there's no wrong door. Just come reach out to us and we'll guide you to the right place to give you the support you need to access data across Canada. So, what type of data assets are available through our member organizations? Our member organizations have administrative data such as data on hospital discharges, emergency visits, physician claims, drug claims. We also have clinical data such as electronic medical records. Many of our data centers also have social data such as education data, immigration data, which is highly relevant in this current political climate. We also work with partners to identify new data sources. So, for example, we work with the CanPath research cohort to make this accessible to researchers throughout the country. And so essentially you can work with our team to put in that request through. So CanPath holds biological and population health data on their cohort. We also work with the Canadian Longitudinal Study for Aging. So great, again, resource if you're looking to do studies on the aging of the population. And then finally, if you are a researcher that has a specific cohort that you're working with for your study, there are also opportunities for linking those cohorts to administrative data held within our data centers, provided that you have the appropriate consents and approvals in place. And really, if you get in touch with our team, we can provide you with some guidance and advice as how to go about that. So, as I mentioned earlier, there are a suite of different resources available on our website to guide you with your specific request. So, for instance, we are doing some work on distributed analysis that Dr. Etier will speak to today. And we have a new site that was launched on HDRN Canada's websites, or a new page that was launched on our website that relate to all the distributed analysis resources. And here I provide the link to GitHub, which provides open source code that people can actually review and look at to see how this method works. We also have a data assets inventory. This is a great resource if you're trying to determine what data is available across our member organizations. You can look at this inventory, search and scope out your project. The algorithm inventory, again, is an incredible resource. It includes validated algorithms of population health measures, and you can easily access that through our website. We also have different privacy tools that can help you with ethics and study design considerations. One that I would highly recommend to check out is our study design page that gives you important guidance around consent language to use. And then finally, we have a web portal for centralized forms and tools. Again, this is where we've harmonized as much as possible the data access process for multi-regional research. So instead of filling out multiple requests for data across our member organizations, you can do so through one centralized form. And we can review your project, and then you can access a team of experts to look at the requests that you've put in and to determine if it's feasible and what are the next steps to kind of be able to access that data. So next up, I will pass it over to Dr. Etier, who will speak to a new innovative technique that the network has been working on to help researchers who, face different challenges when doing multi-regional research. And one big core challenge is being able to move line level data outside of provincial boundaries. So this can be a challenge to actually be able to pull data, especially if you don't have consents in place to do so. And so one new method and technique that we've been working towards and innovating is distributed analysis. And essentially, this allows you to really protect data sovereignty. And so Dr. Etier will speak more to this and this innovative technique. And so thank you so much. And I'll be back at the end of the presentation to talk more about how you can get in touch with Dash.
Thanks, Carrie-Ann. Good day, good afternoon, or good morning, everyone. I'm very happy to present to you today, especially because, as you'll see towards the end of my stretch, we now have fresh off the press results that I'll be able to share with you that we just got yesterday. So on next slide, we'll see that a distributed analysis is now essential to do the next level research. To be clear, the distributed analysis is a technique or a group of techniques you'd want to be using when you want to consider multiple depots of data as one big cohort. So assuming that you are interested in a pan-Canadian cohort, you can see it as one big cohort that happens to be stored in different places. So you have the glossary in front of you. I don't want to bore you with the details. It's now in the new section of distributed analysis in the on the website. But one thing that is important to realize is that we are considering all the jurisdictions you'd be interested in as one big cohort, but stored in different places. So if we go on the next slide, what is the distributed analysis is that what's specific about it, and Carrie-Ann mentioned it, is that you don't need to share line level data. There was this assumption in many scientific circles that if you want to do, for example, logistic regression or many of these techniques, you need to have all the data in one place. So you need to pool data. And we knew upfront when we started HDRN that wasn't going to be a no-go. I think we're all familiar with our jurisdictions. Everyone is very happy to receive data from everyone else, but shipping it around is more complicated. And we knew that'd be the case. For a certain time, we've been supporting methods like meta-analyses, but we know that from a scientific standpoint, this is not ideal if we want to get at the exact result that we're looking for. And so with advances in the literature in recent work, I'd say over the last year and a half, 2 years, we now have methods that will allow you to treat one big cohort, these data in multiple jurisdictions, and get the results that you are expecting. So on the next slides, one thing that you might have heard, and it's also on the website of HDRN, you might hear things about distributed analyses versus federated analyses. So the short answer is federated is a type of distributed analysis. So you have a figure on the side on your screen now. The first layer that most our researchers, I would say, or data user are interested in is the layer of reality. What am I trying to get at? What am I trying to understand? And things like hospitalizations might seem simple, but they might not be so simple. Without naming the organization, there was a project a few years back that looked at length of stays for various diseases in the in hospitals. They've asked multiple jurisdictions to calculate this average length of stay, and they came back together. And some jurisdictions tended to have markedly shorter length of stays than others. And they tried to see if it was because it was innovative ways to deliver care. But turned out that for some jurisdictions, hospitalization started when the decision was made in the emergency room to hospitalize someone. And so at that point, they were under the care of the hospitalization team. And for other jurisdictions, it only started when the patient made it to the hospitalization ward. And certainly in Quebec, you know, there could be multiple hours between the decision and the patient actually making it to the ward. And so the same words, not defined the same way, you end up measuring different things. The second layer is the information model. The information layer, so what information do you have about said reality? And for distributed analyses, this is what is important. Are we talking about the same piece of reality, and do we have information, comparable information about this reality? So for example, the start time, are we all down to the hour in terms of precision, for example? Now, if you have one more constraint, that is the data model, meaning you're using the same technology and you're storing the dates, for example, in the same format with the same types technologically, then you can use federated analyses. So you're already sharing the same definition of reality and the same information. If you have one more constraint, the huge benefit is that you can reuse exactly the same code in every point where you have data, much easier to maintain, simpler to execute, but you are forcing everyone in that analysis to share exactly the same technological environment. So convenient, not always realistic. And while you might hear distributed versus federated, you can simply remember that federated is a type of distributed. So the next slide, you see what it looks like at a very high level. So for example, Karian was mentioning, you can actually bring innovative sources of data like the CanPath genomic data. So say you wanted to consider an analysis between BC and, for example, Quebec. We could link BC data together, put them in a secure environment. We could use Cartagena, which is the equivalent to BC Genomics, ISQ, put them in one other secure environment. These two top clouds, if you will, are still local. So the left one is in BC, the right one is in Quebec, and there's a coordination node that will exchange quantities, so statistics between these two nodes to come down to the actual result. So the next slide will highlight that one thing that is very, very important, these black arrows do not represent line level data being exchanged. I should probably put another star there. It's not because you're not exchanging line level data that you cannot retro engineer it. So if you hear about people telling you, we have a way to do the analysis without exchanging line level data, this is only the first step. The second question you should have is, yes, but can you guarantee that in the end, no one can retro engineer and find back what was the original data, what was being exchanged. And for the methods that you will find on the GitHub that was presented previously, we've looked at it and we've certified that no, it cannot be the case. You are secure and confidential. So if we go to the next slide, I mentioned it. So this is more or less a summary, right? So you need to share the same reality, the same information model. You need to decide what analytical model is the right one. Because one thing that is important is that the fact that you're doing it in a distributed way is not magical. It's still mathematics. And so if the technique that you chose would not work if you had all the data in one place, it will not magically start working if you start distributing your data. So make sure, and HDRN can actually help you out with this to make sure that you are picking the right analytical tool for the question that you're having. Otherwise, it's the classic computer science, garbage in, garbage out. We need to have a good analytical plan. You need to have a good analytical plan. And one thing to keep in mind is even though you are using data from multiple jurisdictions, we can do preliminary analyses in individual jurisdictions to see if you have an effect size, to see if it actually makes sense to move to the distributed analysis, to make sure that you have comparable data across. So all of this can be done before you actually move on. And then you come to the supported methods. We are at this point we're supporting things like linear regression, logistics regression, Cox models, and all the details are on the websites. And I would add that we're supporting them with weight added or not. So plain, for example, logistics regressions or weighted regressions. These are the ones that are on the website, but please, if you do need a specific method, come in contact with Dash. We'll look at it with you. If anything, we might be working on it right now and we'll just prioritize it. If we're not working on it, we're happy to see if there's a large enough demand that actually would simply make sense for us to prioritize it. So on the next slide, this is where it comes interesting. So we were fortunate to have a lot of collaboration with colleagues that had a project in HDRN, and they started the project at the point where those methods were not available because those are fresh off the press. We're publishing them. This is not something that was already in literature. And so we did a Cox regression, so time to event analysis with 3 provinces, Ontario, BC, and Alberta. And so I can tell you now that it worked. We did 3 iterations. They came up with excellent beta, so our estimates look very good. And we were able to cross-reference them with more or less a meta-analysis. So the local sites weighted when we do this approximation, we're in the ballpark. And we were able to do 5 models at once. So different groups of predictors and grouping the outcomes differently to see and confirm that we had robustness in the results. So I can tell you right now that it worked, the code worked, everyone's comfortable. There were a few bumps in the road, like any new methods that we are piloting. But now the good thing is not only the mathematics work, the results are good, but we've also worked on having efficient methods. And that is now the case. So I would really like to thank the group that was involved in that. Aaron has been doing an awesome job in trying to debug all of this. Shay has been really responsive in Alberta. And then Rafik has been very, very supportive, as well as the MIG team, Jean-Philippe and Felix, who's been providing both the science and the code. So I think this is a very nice network-wide achievement. So on the next slide, in terms of key benefits, the enhanced data security as a researcher, you can say, well, why should I care? You care because that makes the data stewards wanting to work with you and actually enabling your project. And that is essential. It is highly scalable. We're talking about HDRN, but HDRN is also in the business of helping you link with external partners outside of Canada. And if that works within Canada, now if you start thinking that you might have partners outside, this is certainly something we can start looking with you. It's highly reproducible. We know we have comparable data to start with. We have code that is well identified. So this is, I think, essential both in terms of publications and also making sure that in different contexts, we try to reproduce the results and confirm that they hold water. And finally, I think this is essential to facilitate collaboration and stop being the land of never-ending pilot projects and actually make it to scale. Next slides, I will pass it back to Carrie-Anne.
Thank you so much, Dr. Etier. So if you're interested in doing distributed analysis, or you have a research project in mind and you would like to consult with our team, I will be here to guide you through that journey. So next slide, please. So essentially, first step, just contact our team. There is no wrong question. There's nothing. We will get you in touch. Like I said, we're a member organization of, data centers, organizations, expertise from across the country, coast to coast. And so we will do our best to guide you and direct you to the right place. So whether you are a researcher, a private sector researcher, a knowledge user, and you have data access questions around the country, we will connect you and guide you where we see that your questions would be best answered. And so I would strongly encourage at any point, please feel free to contact our team. Again, if you have specific questions around distributed analysis, we can always connect you with our modeling and informatics group that can maybe provide some more support and guidance. Once you have a defined research project or a defined request or query in place, and you have specific data that you're looking for, the next step in the process is to work with our team to submit an intake form. In this intake form, you're able to complete and provide some high-level information around what are the data requirements, what's the objectives of your project, what's the high-level scope and methods that you're looking to proceed with, which data centers you're interested in obtaining data from, what type of services are you looking for? Do you want to do distributed analysis? Are you looking to just do local analysis or something else? So in this intake form, we get a sense of your project, and then we're able to review it with our team of experts and essentially provide you with a feasibility assessment and cost estimate for the services requested. So up until this point, it's free of charge. You can consult with our team, get advice and guidance, and it's completely free. And this is typically done within 2 to 4 weeks. So you reach out to our team, we connect with you within 2 business days. Then we make sure you get the intake form if you have a project in mind. And then once that's submitted, we work with our local team of experts to set up a meeting for you to get consultation with them, and then turn around a feasibility assessment and cost estimate, like I said, within 2 to 4 weeks. Now, in step 3, once you've confirmed that you have funding, that you actually want to move forward with a data access request, this is when we kind of confirm with you your data requirements, your analytical plan, what types of services you're requesting, whether or not you need analytical services, whether or not you want to perform a distributed analysis or a local analysis within each data center. Pending on those needs, then we get you to complete the form, we refine your data requirements, and then we really help guide you through the next steps. So we help you understand what different requirements are needed locally. So you'll likely need an ethics approval for your project. You'll need to ensure that you have the appropriate consents and approvals in place depending on what type of project you're doing, and if you're planning to do any linkages between a specific researcher cohort and administrative data. And so essentially we help guide you through those requirements through our team of experts. And then all the way to like analysis, we provide you with guidance through that process. We also provide analytical services where needed. And then finally, to helping you access the data in a trusted research environment in a secure manner. And so, and some of our data centers even offer, a lot of support, even to the point of like publication. So, really get in touch with our team. It's an incredible resource that's available to you. So in terms of the costs, so like I said, up until like consulting with our team, determining whether or not your request is feasible and what are the estimated costs, up to that point, that's completely free of charge. Once you decide to move forward with an actual data access request, the data centers that are a part of our network do charge cost recovery fees. And those really depend on a multitude of factors, such as, how many data centers are you including in your request? What's the level of analysis? Are you doing a linkage to a researcher cohort? How many trusted research environments are you needing access to? And again, what are the annual fees for accessing those environments? So essentially, we'll give you an estimated cost for those services once you come through with a project and we're able to review it. And then finally, I would say the decision to perform a distributed analysis, that has a complete negligible impact on the cost. So really, it's super beneficial if you're trying to scale up your project and include more provinces or territories. Really, the code's available, it's open source. And so essentially you would have to do that exploratory analysis regardless at one of the data centers. The decision to do a distributed analysis, to include more centers and to be able to analyze that data in such a way that gives you a more robust national view, really doesn't impact the costs too much. So that's a great thing. So for tips for success, I would recommend that you consult with our team early on. Like I said, you can contact us at dash@hdrn.ca. If we're not the specific group to help you with your query, like I said, we have different lines of service for knowledge users, decision makers. So we have a new process for those folks to help guide them with data access process as well. We'll just link you to those people. Again, we highly encourage that you consult our online resources. I spoke to the data assets inventory earlier on. This is a great resource to look at what data is available across each of our member organizations and help you scope out your research project. You also have the algorithm inventory that provides you population validated measures of population health. We have lots and lots of information on privacy and legislation and policies and direction and guidance on consent language. So again, I highly encourage you to check out our website. And just today, we've launched our webpage on distributed analysis. So if you'd like to learn more about this method, please do check out hdrn.ca. I would also suggest that if you come with a specific project in mind, having done this kind of research ahead of time will really ensure that you're more prepared. But again, feel free to reach out to us at any point in time and we'll be happy to support you.